A 67-year-old man, someone who exercised 3 times a week, took his medications faithfully, and had never once been told there was anything seriously wrong, went in for a routine blood panel last spring. His doctor looked at the results and asked him to come back in. Not in a week, that afternoon. What the numbers showed was that his kidneys had been quietly declining for what appeared to be years. Not dramatically. Not in a way that sent him to the emergency room. Just slowly, steadily, in the background of an otherwise ordinary life. And the most important detail of his story is not what the doctor found. It is what caused it, because the habits responsible for that decline were not unusual. They were not reckless. They were morning habits. Things he did every single day before the rest of the world woke up. What those habits were, and what his doctor told him to change, is information that everyone over 60 deserves to have before they need it. That man's story is not a rare medical anomaly. It is a pattern that nephrologists, kidney specialists, recognize immediately because they see it walk through their doors repeatedly in patients who look healthy, feel reasonably well, and have no idea that anything is wrong until the window for the easiest intervention has already begun to close. The kidneys are among the most quietly vulnerable organs in the aging body, and they are also among the most consistently misunderstood. Most people think of kidney disease as something that happens to people who are obviously sick. People with diabetes far out of control, people with severe hypertension, people with visible symptoms that announce themselves clearly. But the research tells a different story. A significantly different one. According to the National Kidney Foundation, approximately 37 million Americans are living with chronic kidney disease right now, and the majority of them do not know it. That number is not a footnote. It is the central fact around which everything else in this conversation is built. Because if tens of millions of people are carrying this condition without awareness, then the habits creating or accelerating it are, by definition, ordinary habits. Common habits. The kind of habits that feel completely safe because they have never produced an obvious consequence. The kind of habits that happen in the morning, before the day begins, when most people are simply following the routine they built years ago without ever questioning whether that routine was serving their kidneys. The man I mentioned had 4 specific morning habits that his nephrologist identified as contributing to his declining kidney function. 4 habits. None of them dramatic. All of them, in his own words, things he thought were either neutral or actually good for him. That is the part that catches most people off guard. Not that they were doing something they knew was harmful, but that they were doing something they believed was harmless or even healthy for years. If you have a morning routine that you follow without much variation, and most people over 60 do, then what his doctor told him that afternoon is directly relevant to your life right now. And what changes the outcome is not complicated, but it does require knowing what you are looking at, which is exactly what we cover next. To understand why morning habits carry such specific weight when it comes to kidney health, you need to understand what the kidneys are actually doing and why the aging process changes the stakes so significantly. The kidneys are 2 fist-sized organs positioned in the back of the abdomen, and their primary job is filtration. Every single day, they filter approximately 200 liters of blood, removing waste products, balancing fluids, regulating electrolytes, and producing hormones that control blood pressure and stimulate red blood cell production. That is an extraordinary workload for organs most people never think about until something goes wrong. Here is the medical reality that changes everything once you understand it. After the age of 40, kidney function declines naturally at a rate of approximately 1% per year. By the time you reach 60, you may already be operating at 80% of the kidney function you had at your peak. And that is under ideal conditions in a healthy individual with no additional stressors. Now add in the habits. The ones that create chronic low-grade inflammation. The ones that force the kidneys to work harder than they should every single morning. The ones that restrict blood flow to the renal tissue or overwhelm the nephrons, the tiny filtration units inside each kidney, with substances they are increasingly less equipped to process efficiently. The result is not an emergency. It is erosion, slow, invisible, cumulative erosion of function that does not produce pain, does not produce obvious symptoms in its early and middle stages, and does not show up clearly on a basic blood panel until a meaningful percentage of function is already gone. That is the cruel architecture of kidney disease. By the time the standard markers like creatinine and GFR appear significantly abnormal on routine blood work, you have often already lost more function than you can recover. The man whose story opened this video was not in kidney failure, but his GFR, his glomerular filtration rate, which measures how efficiently the kidneys are filtering blood, had dropped into a range that his doctor described as a warning he could not afford to ignore. And when they traced back the contributing factors together, the morning was where the conversation kept returning. The first thing he drank each day, the way he took his medications, the supplement he had been adding to his morning routine for 3 years because he read it was good for joint health, the amount of protein he was consuming at breakfast in an attempt to stay strong and maintain muscle. Each of those choices, independently, might have been manageable. Together, in a body where kidney function was already declining with age, they were accumulating into something the nephrons simply could not keep absorbing without consequence. The medical explanation for how each of those habits affects kidney tissue and why the morning timing specifically matters is something most people never get told, until now. What changes the outcome in kidney health and in most of the chronic conditions that quietly reshape life after 60 is not dramatic intervention. It is early awareness. And the reason early awareness matters so profoundly in the context of kidney disease specifically is something called the nephron threshold. You have approximately 1 million nephrons in each kidney. These are the microscopic filtration units that do the actual work of cleaning your blood. And here is the critical fact. Once a nephron is damaged beyond a certain point, it does not regenerate. It is gone. The remaining nephrons compensate. They enlarge slightly and work harder to pick up the slack. But this compensation itself creates additional stress on the tissue, and the cycle of gradual loss continues. This is why timing is not simply important in kidney disease. It is everything. Because there is a window, a real, measurable window, during which the trajectory can be changed, during which the habits causing harm can be identified and modified, during which the remaining nephrons can be protected rather than continued to be eroded. Nephrologists refer to this as the modifiable stage, and it spans a significant portion of the chronic kidney disease spectrum. Stages 1, 2, and even stage 3 represent windows during which the right changes to diet, hydration, medication management, and specific daily habits can meaningfully slow the rate of decline and, in some documented cases, stabilize function for years. The man in this story was caught at that window. His doctor saw the numbers, sat down with him, and walked through every morning habit in detail. Not to frighten him, to give him information that changes outcomes when it arrives early enough to matter. That is the appointment that most people do not have. Not because their doctor would not give it, but because the standard of care does not typically include a detailed morning habit review unless the patient is already in a later stage of disease. Which means the information you are receiving right now is the equivalent of that conversation. The one that happens before the finding becomes a crisis. The one that gives you choices. The advantage you have at this moment, right now, watching this, is that you are learning what he learned while the window is still open. Before the symptoms that most people dismiss as aging have a chance to become something more. And what those symptoms actually look and feel like, and why so many people over 60 mistake them for something else entirely, is exactly where we go next. There is a specific reason why kidney decline goes undetected for so long in so many people, and it comes down to the nature of the warning signs themselves. They do not arrive with urgency. They do not feel like a kidney problem. They feel like Tuesday. They feel like getting older. They feel like the kind of thing you mentioned to your doctor, and then both of you move past because there are other things to discuss, and these particular symptoms do not seem alarming enough to anchor the appointment around. The first sign is fatigue. Not the fatigue of a bad night's sleep, but a heaviness that settles in during the late morning and never fully lifts regardless of how much rest you get. When the kidneys are not filtering efficiently, waste products called uremic toxins begin to accumulate in the bloodstream at low levels. These toxins do not cause acute illness at early concentrations. They cause a background sense of depletion that most people attribute to age, stress, or simply not sleeping as well as they used to. The second sign is changes in urination. Not dramatic changes, but subtle ones. Going more frequently at night. Noticing that the color is darker than usual in the morning. Occasionally seeing a foamy or slightly bubbly quality to the urine, which can indicate protein is leaking through a compromised filtration membrane. This sign is consistently dismissed as hydration variation. It is rarely connected to kidney function without a clinical prompt. The third sign is mild swelling, particularly in the ankles, feet, or around the eyes in the morning. The kidneys regulate fluid balance, and when they are struggling, excess fluid can begin to accumulate in soft tissue. A slightly puffier face in the morning. Shoes that feel marginally tighter by afternoon. These things are noticed and then explained away. The fourth sign is a subtle but persistent change in mental clarity, a slight fogginess, a slower retrieval of words, a sense that concentration requires more effort than it used to. Wormic toxins affect neurological function at subclinical levels long before they are detectable on a basic panel. And the fifth sign, the one that most consistently gets ignored, is a change in blood pressure readings at home. Not a crisis. Just a pattern of numbers running slightly higher than they used to, morning after morning, without a clear explanation. The kidneys produce a hormone called renin that directly controls blood pressure regulation. When kidney function declines, this system can become dysregulated in ways that show up on a home cuff before they show up anywhere else. I want you to think carefully about this next part, because some of what I have just described may feel very familiar. If any of these signs have shown up in your life recently, and you push them aside as just getting older, type the words "not anymore" in the comments, because that phrase is the beginning of something different. And what changes the trajectory when you recognize these signs? The specific morning habits that protect what remains is exactly what we address now. The first layer of what turns kidney health around, and what the man in this story was told to change immediately, begins before he swallowed anything. It begins with the first decision of the day, which for most people over 60 is something so automatic they do not recognize it as a decision at all. The first morning habit that consistently shows up in kidney health research as a contributing factor to accelerated decline is chronic mild dehydration. Here is what happens during sleep. You spend 7 or 8 hours without fluid intake. By the time you wake, your blood is measurably more concentrated, your kidneys are already working harder to maintain filtration balance, and your body is in a mild but genuine dehydration state. What most people do in the first hour of waking is reach for coffee, sometimes 2 cups, before a single glass of water. Caffeine is a diuretic. It accelerates fluid loss through the kidneys at the exact moment when the kidneys are already processing concentrated blood from an overnight fast without fluid. This does not cause acute kidney injury, but it sustains and deepens the dehydration state, forces the nephrons to operate under higher osmotic pressure, and does so every morning, repeatedly, across years. The research on hydration and kidney function is consistent. Adequate daily fluid intake is one of the most directly protective behaviors for long-term renal health, and morning hydration specifically, before caffeine, before food, before anything else, has an outsized effect on how the kidneys begin their filtration workload for the day. The second morning habit that surfaced in his case was the way he was taking his over-the-counter pain medication. He had a mild arthritis-related ache that was worse in the morning, and he had developed the habit of taking an NSAID, a non-steroidal anti-inflammatory drug like ibuprofen or naproxen, with his first coffee before breakfast several mornings a week. NSAIDs reduce blood flow to the kidneys by inhibiting the prostaglandins that help maintain renal circulation. In a young person with full kidney function, occasional NSAID use carries minimal risk. In a person over 60 with already declining nephron count, regular morning NSAID use, especially on an empty stomach and in a dehydrated state, creates a compounding stress on renal tissue that accumulates meaningfully over time. His nephrologist did not tell him to never use pain relief. He told him to understand the timing, the frequency, and the hydration context, and that those 3 variables together were the difference between occasional use and consistent harm. The third habit was the supplement. 3 years of a high-dose creatine supplement taken every morning because he had read it supported muscle function and physical performance. Creatine metabolism produces creatinine as a byproduct, the same compound used to measure kidney function. In an already stressed filtration system, excess creatinine load places additional burden on the very pathway that his blood work was already showing signs of strain in. What he changed in the weeks that followed, and the results his doctor documented at the 3-month follow-up, is exactly what we cover next. The second layer of what protects kidney function long-term goes deeper than individual habits. It addresses the underlying physiological environment in which those habits operate, and this is where the research consistently finds the most durable results. After the man made the first set of changes, morning hydration before caffeine, restructuring his NSAID use, pausing the high-dose creatine, his 3-month follow-up showed measurable stabilization in his GFR. Not dramatic reversal, stabilization, which, in the language of kidney medicine, is a significant result. Because stabilization means the erosion has slowed. The window has been held open, and from that position, the second layer of protection becomes possible. The fourth morning habit his nephrologist addressed was breakfast protein, quantity, and source. High-protein diets, particularly those built around animal protein, increase what is called the glomerular filtration pressure. The kidneys have to work harder and faster to filter the nitrogen waste products produced by protein metabolism. In a young, healthy kidney, this increased pressure is handled without consequence. In an aging kidney with reduced nephron reserve, chronically elevated glomerular pressure contributes to a specific type of damage called hyperfiltration injury, the nephrons essentially being overworked into progressive deterioration. His breakfast had consisted every morning for years of eggs, protein powder mixed into coffee, and often a slice of deli meat. Not unreasonable by general nutritional standards. But in the context of his kidney function numbers, it represented a consistent morning protein load that was placing unnecessary demand on a filtration system that was already working with reduced capacity. The adjustment was not elimination of protein. It was calibration, reducing the morning protein load, shifting a portion toward plant-based sources, and distributing intake more evenly across the day to prevent the filtration spikes that concentrated morning protein created. The fifth habit was one that surprised him. It was something he had always associated with health, his morning blood pressure check. Not the check itself, but what he did with the numbers. For 2 years, he had been recording slightly elevated readings and attributing them to stress or poor sleep without reporting the pattern to his physician. He had not connected blood pressure variability to kidney function. His nephrologist explained the bidirectional relationship, that high blood pressure damages kidney tissue over time, and that declining kidney function in turn drives blood pressure higher. The morning reading he had been quietly watching was a signal that the system was already under strain. Managing blood pressure through medication adjustment, sodium awareness in the morning meal, and consistent reporting of the home reading pattern to his physician became part of the second layer of protection that stabilized his trajectory. The research on this two-way relationship between blood pressure and kidney function is clear and consistent. And here's the part that the research confirms most powerfully. The people who stabilize and maintain kidney health into their 70s and 80s share one common behavioral profile. They did not wait for symptoms to become undeniable. They paid attention earlier. And what that earlier attention made possible for them, and for you, is exactly where we end. You are not the person in the story who almost missed it. You are the person who found out in time. That is not a small distinction. It is the entire difference between a story that ends with a crisis and a story that ends with choices. The man who opened this conversation did not know, on the morning before that blood panel, that anything was wrong. He was doing what he had always done. He was following a routine he had built over years and never thought to question. And then he sat across from his doctor, heard what the numbers meant, and walked out of that office with information that changed what his next decade looked like. You have now received the same information, not in a clinical office, not after a finding that required an urgent callback, but right now, before any of that has happened. Before the window has closed, before the habits have had the chance to accumulate further. Everything you learned in this video is now part of how you move forward. The 5 morning habits that quietly accelerate kidney decline after 60. Morning dehydration before caffeine, regular NSAID use in a dehydrated early morning state, High-dose creatine supplementation, concentrated animal protein loads at breakfast, and unaddressed morning blood pressure patterns are not exotic dangers. They are ordinary habits that operate beneath the threshold of obvious consequence until the accumulation becomes something a doctor has to address urgently. You now know what they are. You now understand why the kidneys are specifically vulnerable after 60. You understand the nephron threshold and why the modifiable window is the place where real protection happens. You understand the 5 warning signs that are most commonly dismissed: the fatigue, the urination changes, the mild swelling, the subtle cognitive shifts, and the quiet blood pressure pattern. And you understand what the first and second layers of change look like in practice. I share stories like this because they are real, because the people they represent are real. And because you are real, I'm sitting wherever you are, watching this, and your health genuinely matters to every person in your life who depends on you being here and being well. Share this with someone who might be where that man was, before the appointment, before the finding, before they knew. You could be the reason they find out in time. Stay with us. We will keep bringing you what you deserve to know.